My name is Tierney Sears. I'm going to be doing my presentation over physical child abuse. Physical child abuse can be defined as an injury that results from some form of physical aggression. This could include beating, slapping, hitting, pushing, punching, shaking, pulling hair, choking, biting, pinching, and also burning with cigarettes, scalding water. Heated objects can also be used. And severe physical punishment is also defined as a form of physical child abuse. Severe physical punishment is defined as the use of physical force with the intent of inflicting bodily pain, but not necessarily injury, for the purpose of correction as control. The use of severe physical punishment can not only affect a child physically, it can affect your child's emotional state, social development, behavioral development, as well as affect your child's overall life all the way into adulthood. Three different specific types of physical child abuse that are common and or seen more in practice that are very specific are shaken baby syndromes, where a baby or a toddler is shaken. Most of the time the baby or toddler won't quit crying, and the parent themselves just literally does not know what to do. So the end result is the baby being shaken, and most oftentimes this will lead to some form of head trauma, and in some cases can end up in death. Munchausen by proxy syndrome is when the parent pushes off an illness or makes up an illness for the child, basically, ultimately, just to get attention. They'll try to convince others that the child is sick. They'll take them to see medical professionals. They'll try to get them on various types of medication, just ultimately to receive the attention that the child gets from these illnesses. And also, drug and alcohol use during pregnancy is considered a form of physical child abuse. Drug and alcohol use during pregnancy can lead to multiple different birth defects, syndromes, and different various problems with the child when they're born. More often than not, a parent will be the child's main or primary physical abuser, and risk factors for a parent abusing their child are parent competency and attitudes, their age and education level, socioeconomic status as well as income, their history of child abuse. An adult who was abused as a child is by folds more likely to abuse their own child. Interpersonal problems with themselves, limited social support, especially very young mothers who don't have very much support from the baby's father, from various family sources. A lot of times will have a very, very difficult time. Substance and alcohol abuse, marriage instability, and domestic violence. A lot of times if a father or husband or male figure is abusing the female, they can't retaliate back against that male. So a lot of times what they do is actually end up abusing the child, because the child is more vulnerable than they are, and they can take out their aggression on the child without the child being able to retaliate back. And finally, a child that comes from an unwanted pregnancy, a lot of times the parent will actually take out their abuse and their anger on the child. If you weren't here, I wouldn't be doing this, or I wouldn't be struggling, or I wouldn't have to take care of you. So a lot of times abuse can come from that kind of a situation. There are various different forms that can be used in a hospital setting. Most places have their own form that they use, and what these do is the tests will be performed by social workers, counselors, and it's basically a list of questions about your lifestyle, about the way you're feeling. Do you feel depressed? And what happens is that will come up with a score that will allow that caseworker, social worker, or counselor to identify high-risk situations for potential abuse. A few of them are called a parenting stress test, the Michigan Screening Profile of Parenting Scale, and the Conflicts Tactic Scale, as well as Child Abuse Potential Inventory, are just a few various forms that have been used in different facilities. These are some statistics that have been shown. 25% of children will experience at least one form of physical violence throughout their childhood, whether it be hitting, pinching, slapping, punching, anything at all. 25%. 7% of children will experience some form of serious physical abuse. And children with disabilities are 3 times more likely to experience abuse than a normal, healthy, fully functioning child would. Some national statistics that I found, this goes back to the year 2005, so the statistics are a little bit old, but about 3.3 million reports of alleged abuse and or neglect that involved 6 million children were made. About 900,000 children out of those 6 million turned out to be true victims of some form of child abuse or neglect. 16% of those children suffered from some form of physical abuse, and about 1,400 of those children actually died as a result from the injuries that they sustained from the physical child abuse. Some big indicators of suspecting child abuse, in multiple injuries that come up and the way that a parent or a child is telling you that they occurred don't really make a whole lot of sense. If you have many injuries in various stages of healing, many bruises that are different colored, some that are new, some that are old, and a big way is broken bones. Actually, when they get x-rayed, you can see old breaks that haven't healed properly with a new break. So a lot of times it's a huge indicator of some form of physical child abuse. Bruises, lacerations, swollen areas, marks on the face, the back, the chest, the genitals, the buttocks, and the thighs are also places that bruises and lacerations can occur, but typically those are going to be harder to see unless the child actually says something to you or you're in the situation where you're able to physically assess the child. Various wounds that look like bites, cigarette burns, broken bones, puncture marks, missing hair. These are indicators of some severe physical child abuse that is occurring, and also children who show withdrawn or aggressive behaviors around other people, around a specific adult, around a parent. Those are huge indicators that child abuse should be suspected. Specifically for the state of Kentucky, these statistics go back to last year in 2012. There were 3,400 cases that met criteria to be investigated for child abuse. All of these cases involved 47,000 children. The number of cases that were sustained for actual neglect and or child abuse was 9,935, and all of those cases involved about 15,500 children. Near fatalities within those sustained cases were 33 children, and the actual number of fatalities in the state of Kentucky for last year for child abuse is 22. In Kentucky, 77% of those fatalities and near fatalities were parent abusers. Head injuries counted for 44% of the 99 cases of physical child abuse in the state. 7% of children who fall into that statistics were intentionally suffocated, and 6% of these children died from an intentional gunshot wound. One thing that I found very interesting was the fact that 57% of children that were abused were actually male children and 43 were female. I personally, before reading the statistics, thought that that result would be backwards and that more female children would actually be abused. 79% of those children were Caucasian, 12% African American, 7% biracial, and 1% being Hispanic. And 26.2% of abusers were males that were between the ages of 25 and 30, which is the largest age class. And 38.8% of female abusers were between the age of 21 and 25. The state of Kentucky is actually an anonymous reporting state, so when you call to report child abuse, the only thing that you have to tell them is the name, sex, and approximate age of the child, the name of the person that you believe that is abusing or neglecting the child, the description of the injury, neglect, or the threatened harm that they have, if there's anything that those investigating the report should be aware of, such as an immediate risk that could be posed with guns, etc., on the scene, not only to the child but to a caseworker.